Good evening to everyone and welcome to today's NEET PG mock test. So 2019 NEET, another 6 months to go, and you must be brushing up the high-yield topics and getting ready. So from this week onwards, we will have every Sunday afternoon 12 to 2:30 a discussion on the essential questions, at least 100 questions in the 300 paper, which are critical questions. We'll have a review discussion following the mock test. Can the online students can punch whether the voice is loud and clear? Yeah, I'm happy to see 10 plus students watching. Now, what is the valid ground of divorce for the female? Impotence of the male partner or the extramarital affairs of the male partner, unemployment, anything but not infertility. Infertility cannot be ground because the marriage is not on the promise of producing the children certain definitive number in a definitive period. Bite mark, where does it help? It will help to identify the accused, assessment of the height and the type of the teeth the person is having, etc. Now, in the gunshot injury, what are the important key features? Typically, the tissue opening of a gunshot injury will be on the same side as that of the gunshot injury. It will be a radiating wound, there will be a grease collar, there is a gutter injury. So this is how the point where the gunshot is being done, it is on the same side that you have the wound is what you have to basically remember. Now, this is an example of an abrasion collar. Around 20 to 30 questions will be image based questions, so you must be doubly sure that this is how a abrasion collar typically looks like. Perjury, that is falsifying under the oath. What are the true statements about it? It is the section 191 of the IPC that talks about perjury, not the 190 is what you have to be very sure. And the witness can be prosecuted for perjury. He is liable to be prosecuted for perjury is what you have to basically remember. What is corpus delicti? You should remember that it is the body of offense, the essence of the crime, and it includes the body of the victim and the other facts which will help in concluding the cause of the death is what you need to basically remember. What are the various ways by which a crime scene examination can be done? There is a grid method, strip method, wheel method, etc., etc. Basically, when you get into the crime scene, you must think that you have done the crime and you need to walk in the crime scene like that. So what are the various ways of walking? Typically in the strip method, the personnel will walk the path from one end of the crime scene over to the other side of the area and then return in the direction which he has first started. That is called a strip. Similarly, like a wheel, if you happen to walk in the crime scene to imagine how the crime would have been done, that's called wheel method, spiral method, zone method, grid method, line method. I leave the literature for you. With regard to tuberculosis, without a question on tuberculosis, there is no NEET PG, no AIMS exam. So you need to be doubly sure. Among the newly recognized pulmonary TB cases, how many of them are multi-drug resistant TB? It is not 5%, but it is 4.1% are basically the multi-drug resistant tuberculosis is what you have to basically remember. Very nice to see around 16 online students watching. Can you please punch whether the voice is loud and clear? So we are back with our mock tests are very popular since 18 years. for the simple fact that there is not just a test, but there is a discussion which will help you to debate, to fight, to remember certain key points so that it acts like a practice. So a mock test without discussion versus mock test with discussion. With discussion, it is like answering 10 mock tests. So be very sure. So what is the importance of a lepromin test is a very, very important question. As all of you know, that lepromin test is having a epidemiological, is having a prognostic significance. It talks about the immunity status. Lepromin test basically checks the cell-mediated immunity. Unless the person has a intact cell-mediated immunity, the lepromin test may still turn out to be negative, though the person is having the leprosy, and it can differentiate different types of leprosy, borderline, tuberculosis, lepromatous, etc., etc. Now, a leprosy person presented with sural nerve and radial nerve involvement. So, typically lepromatous neuropathy, neural involvement is there. You will treat him like a multibacillary case for about 12 months is considered to be the protocol. So, what is the difference between a histogram versus a bar diagram basically? So, you have the heights and the frequency at which these heights are typically happening. Height is an example of what? It is an example of a continuous data, not a discrete data. Discrete means yes or no kind of answer. Continuous means weight, height like that, which is having a value. Suppose if pregnancy is there, it's discrete or continuous? It is discrete because there can be no pregnancy or yes pregnancy, but there can't be a slight pregnancy. Whereas height, one can be 10, one can be 5, one can be 3, one can be 2, but some value will be there. Such things are called continuous data. For continuous data frequency, you will be using the histogram, and in the case of the bar charts, they are typically used for the other kind of variables which can be ordinal data or nominal kind of a data set. So